Hello, this is Dr. Taylor, and I want to tell you about two male patients that I recently saw with erectile dysfunction. One was a 50-year-old on Cialis, and the other was a 21-year-old college student that had been on antidepressants for anxiety since high school. As always, understanding how the body functions will lead you to the correct test and the correct treatment. There is the sympathetic nervous system, fight or flight, and the parasympathetic nervous system, rest and digest. The parasympathetic nervous system controls erection, and the sympathetic nervous system controls ejaculations. These systems must be in balance for erectile dysfunction or premature ejaculation not to occur. If these systems are out of balance and the sympathetic overrides the parasympathetic nervous system, a man can have difficulty achieving and maintaining erection. If the sympathetic drive is too strong, the man will ejaculate prematurely. Is there a way to identify and correct this problem? The International Neurological Journal states that heart rate variability analysis may serve as a screening tool to evaluate altered autonomic nervous system or the sympathetic and parasympathetic nervous system activity in men with erectile dysfunction. I was surprised when I read that the Journal of Neurology and Psychiatry states that it is essential to use screening for autonomic dysfunction in patients with erectile dysfunction. This same journal states that heart rate variability should be a part of the erectile dysfunction workup, along with excluding central nervous system disorders by clinical exam and evaluate the peripheral nervous system clinically, but third, you should test autonomic, sympathetic, and parasympathetic nervous system function. Heart rate variability is a way to measure the power and balance of the parasympathetic nervous system and the sympathetic nervous system. The test simply measures the distance between heartbeats. The parasympathetic nervous system increases the distance between heartbeats, and the sympathetic nervous system decreases the distance between heartbeats. The test is painless and takes 5 minutes. This is a normal test. This is how the parasympathetic nervous system should look on this test. Now, this test is abnormal. You can easily see the decreased function of the parasympathetic nervous system in this test. This is the 50-year-old on Cialis. Now, Cialis increases a substance called nitric oxide. Nitric oxide causes blood to flow into the penis for erection. However, the parasympathetic nervous system must first send the message for the blood vessels to relax. If the parasympathetic nervous system is not working, the message is not sent. This is a 21-year-old male college student. He has been on antidepressants for 6 years. He has erectile dysfunction and low libido. His testosterone level is normal. The antidepressant is not what he needs to be a normal 21-year-old. He has anxiety because his parasympathetic nervous system is not strong enough to override and balance his sympathetic nervous system or his fight or flight system. These neurotransmitters must be in balance for the brain to function normally. They also must be in balance for the sympathetic nervous system and the parasympathetic nervous system to function in balance and normally. Antidepressants do not increase the amount of neurotransmitters. They only make low levels last longer. That is why they become less effective over time. The real problem is not corrected. Neurotransmitters, the chemicals that transmit messages between neurons or brain cells, are all made from amino acids, the building blocks of proteins. Both of these men drink the Taylor MD Formulations product Amino Restore every day. We have been performing heart rate variability tests in our office for the last 3 years. This product has been clinically shown to improve heart rate variability. The other Taylor MD Formulations product that these men took is EasyCalm. EasyCalm contains natural ingredients that increase the production of the parasympathetic neurotransmitters. These ingredients decrease anxiety and increase the production of calming neurotransmitters that enhance parasympathetic nervous system function. Both men called me back after approximately 6 weeks to reorder the two products. They were both very happy and surprised the supplements had worked so well. If you are interested in having a heart rate variability test done, call the Taylor Medical Group at 678-443-4000. To order these two products, go to www.taylormdformulations.com.